Thanks for those of you who are saying hi in the question and answer. It's good to see all of you as well. I apologize that we're starting a couple of minutes late. We were having some technical issues with our sound. So hopefully everyone is able to hear me now. All right, someone just said yes. So I'll give people just a couple more minutes to log in since we started a little late because of our technical issues, sound issues. All right, we're going to go ahead and get started. So if you're just now logging in, we were having some technical issues with our sound, which we believe we have corrected now. So we're going to go ahead and get started with the webinar. So the topic for today is You Worry Too Much, which is on understanding anxiety in children and adolescents. So this webinar is being brought to you by Mindspring Mental Health Alliance, as well as Polk County Behavioral Health and Disability Services. So we want to thank them for partnering with us and sponsoring today's webinar. They have been sponsoring several of our children's mental health webinars, and so we appreciate them and their support of us. So for today, everyone's microphones are muted and your cameras will be off. Closed captioning is available, so captions can be turned on and off by clicking the CC button at the bottom of your screen. The question and answer feature is on, so if you have questions, type them in there. Just so you know, we have over 800 people who have signed into the webinar today, so I won't be able to answer all of your questions, but I will try to answer as many as I can. So some frequently asked questions. Will a recording of the webinar be available? Yes, everyone who's registered for today's session will receive a recording and resources link via email tomorrow. We cannot send out the individual slides. And then how can I request a certificate of attendance? So everyone who's registered for today's webinar and joined the live session will receive an email from certificates@mindspringhealth.org soon after the webinar ends. So complete the webinar follow-up survey link in that email and you will automatically receive your certificate. Certificates are not available for webinar recording viewers, only for those who attend the live sessions. And then the other question that we often get is about CEUs. So we are not able to provide professional continuing education units for these community education webinars. But if you get the certificate of attendance, then you may be able to turn that in and get credit for it. We just can't guarantee that for you. The other thing is even if you are not wanting a certificate of attendance, if you can stay on and complete that survey at the end, that would be very useful to us. It gives us helpful information. It also gives us information that we send to our funders so that we can continue these webinars. So if you can fill that out, we would really appreciate that. So my name is Susan Dannon. I am a mental health professional with over 30 years of experience now. I work in mostly children's mental health, although I do see some adults, and anxiety disorders are actually one of my specialty areas. So the things that we're going to be looking at today is we're going to do an overview of anxiety, what anxiety looks like in children and teenagers, the impact on anxiety on the brain, diagnosing youth, treatment options, and then what can we do to support these children. So, anxiety in children and teens. So first of all, it's good to understand exactly what anxiety is. So anxiety is fear that puts us on alert. So it is biologically meant to keep us safe by alerting us to dangers in our environment. So it does have a purpose. We don't want to completely get rid of anxiety because anxiety does some good things for us, such as motivate us, helps us focus, helps us to be aware of danger that is around us. However, individuals with an anxiety disorder are in a state of alert with no direct reason or cause. So that fight or flight system that is there to protect us becomes overactive, is working too hard, and then starts creating false alarms in a sense. So we experience anxiety in areas and things that we don't necessarily need to be anxious about. So something to kind of understand also is there is a difference between anxiety and normal childhood fears. So anxiety is a normal childhood experience. We do want our children to be cautious. We want them to sort out typical developmental fears. And for us, we want to be able to know what those normal developmental fears are as compared to an anxiety disorder. So, for example, separation anxiety in infants and toddlers is very normal because they don't have object permanence, which is an understanding that when someone leaves a room that they still exist even though you can't see them. So that is a normal, typical developmental fear. And children need those fears in order to develop and understand the world around them. And as their understanding grows, a lot of those fears dissipate over time. So what we're talking about with an anxiety disorder is a persistent fear that something bad is going to happen. And that fearful thought plays over and over again in the mind. So usually people will talk about the fact that they have this thought in their head and they're not able to get rid of it. And they struggle to shift away from that thought. So the thoughts are becoming overwhelming, they're intrusive, they are not able to control the thoughts. And so that impacts your ability to enjoy life. The other thing is to understand is that individuals with anxiety disorders are often aware that their thoughts are not normal, and so therefore they often hide their symptoms. And I think what makes that difficult is that a lot of kids with anxiety often are very bright, articulate children who sometimes are anxious because their vocabulary is outstripping their cognitive and emotional awareness. And so that turns into anxiety. And often they know that anxiety is not normal, it's not like other kids their age. And so they become embarrassed about that. And they're often, bright and articulate enough that they know how to hide that from people. And they're also usually very frustrated and very upset with themselves that they can't stop their worry. So how young are we talking about when we're talking about looking at anxiety disorders? Well, anxiety about a possible future bad outcome does take cognitive development and imagination. So really, until you have pretend play where you have that imagination, you really can't have anxiety. So when children are starting to engage in pretend play, that is one of the best markers, and that normally emerges around the age of 2 years old. So basically, you can't worry about the possibility of a future bad outcome until you are able to have that cognitive development and imagination to imagine what a future outcome could be. So the average age of diagnosed children with anxiety disorders is 11 years old. However, it can be diagnosed in preschool age children. Um, so the 11 years is just the average age. So how common are anxiety disorders? Well, the first year of COVID-19 pandemic, global prevalence of anxiety and depression increased by a massive 25%. The latest global burden of disease study shows the pandemic has affected the mental health of very young people in a disproportionate manner. So what we're talking about is that a lot of what we believe it has been triggering an increase in anxiety disorders in children started with the pandemic, as far as it becoming more significant. And when you think about that, is that we basically had a global trauma that impacted everyone. And trauma is one of the things that can trigger anxiety disorders. So many of our children at this point have been through a significant trauma that we are seeing anxiety disorders developing at a younger age, and there is more severity to the anxiety disorders. So someone had asked in the question and answer, separation disorder creates more severe anxieties in children. So separation anxiety really can't be diagnosed until a child is at least 3 years old, because they have to have moved out of that object permanent stage. Um, so it can be a marker that there may be other anxiety disorder type issues. Um, and so it can be kind of a starting point, but there are also kids that I've worked with that only have separation anxiety disorder, and it doesn't develop into other anxiety or generalized anxiety. So hopefully that answers that question. So how common is the anxiety disorders in the US? Well, even before the pandemic, anxiety was increasing among children and teens, rising to 27% from 2016 to 2019. In 2018, anxiety was 7.1%, so roughly 4.4 million children. By 2020, 5.6 million kids, so 9.2%, had been diagnosed with anxiety disorders. So we did see a significant increase. However, anxiety disorders were already increasing even before the pandemic. We believe some of that has just been about all of the social stress, media, having so much access to so much information. Um, So all of those are kind of things that were contributing even before the pandemic. So there are a few risk factors to developing anxiety. So the first is biological factors. So it's the genes and your brain wiring. And then there are psychological factors which have to do with the person's temperament and their coping strategies and how able are they to tolerate a certain amount of anxiety and risk. And do they have enough coping skills to deal with that anxiety when it occurs so that it does not become so large that it starts impacting their daily functioning? And then we have the environmental factors. So that can be things such as anxious parenting or troubling early childhood experience and the environment. So that's kind of where the pandemic piece comes in, is that we know that trauma at early ages and stages can be a risk factor for developing anxiety disorders. So let me go back to the question and answer and see if there's any other. So someone had asked about individuals on the autism spectrum who may never really develop imaginative play, but still have anxiety. Yes, absolutely. The imaginative play is just kind of a marker for very young children that they need to have that before they can really have a comprehension. When you're talking about autism spectrum, a lot of times, even if they don't have really deep imaginative play, they have got to a level where they are able to think about the future and understand things happening in the future. So while that is a marker for a lot of children, for children who are neurotypical or on the autism spectrum, um, that may look a little bit different. And then someone else had asked if the young children can be susceptible to anxiety if they've had trauma at a very, very young age, such as being born prematurely. And yes, that is something that we have actually found in the research, is that uh, children who are born premature actually have a higher incidence of anxiety than the general population. So we're going to look at some research in regards to the brain and anxiety. So there was a research study that was published in 2020 by Stanford University School of Medicine. It was the first study using brain scans to examine how emotion regulation circuits are changed by chronic anxiety and stress in children. And so the children who were studied were 10 to 11 years old. And what they did is that they showed these children aversive images. So images that would typically stress a child or trigger an anxiety type reaction. So what they did was they studied the interactions between the amygdala, which is the fear center, and the prefrontal cortex, which is our reasoning center. So what they found was that in chronically anxious children, the signals were stronger from the amygdala to the prefrontal cortex than children who were not chronically anxious. So what we were seeing is a much stronger reaction to those things that were triggering. So what that meant was those higher levels anxiety were associated with less positive initial reactions to the aversive images. So they had less ability to regulate emotional reaction in response to the aversive images, and they had more impulsive reactions to the aversive images. So that less controlled, more impulsive reaction when reviewing those reversive images suggests that the prefrontal cortex is less able to carry out its job when a person has chronic anxiety. So we're now going to look at diagnosing children. And someone had asked in the question and answer about how many children are misdiagnosed. That's always a really difficult thing to answer because so many people look at it from different lenses. And when we're talking about like an international audience, there are differences in how we describe and look at anxiety. So hopefully with going over some of this, that will answer some of those questions about the diagnosing and the misdiagnosing. So just so we have an understanding of where the diagnosing criteria are coming from, we're going to be looking at the DSM-5-TR, which is the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition with the text revision. So that is the book that is put out by the American Psychiatric Association, and it is the method that we use to diagnose individuals in the United States with anxiety disorders. So the diagnoses that are in the DSM-5 include generalized anxiety disorder, which is sometimes referred to as GAD, panic attacks, specific phobias, separation anxiety disorder, social anxiety disorder, and selective mutism. So within the DSM, there are a list of criteria and symptoms, and the individual needs to meet a minimum number of those symptoms to be given that specific diagnosis. So with generalized anxiety disorder, that is an anxiety disorder where you are anxious about a variety of situations. So you have a generalized sense of dread that something bad is going to happen. Then the next one is panic attacks. So a panic attack is when you have a very intense reaction to anxiety. So you may have difficulty breathing, your heart is racing, you may feel dizzy or numb. A lot of times people will feel like they are about to pass out. I have had adults who have gone into the emergency room thinking that they were having a heart attack when they were actually having a panic attack. So that is how intense and how real it feels. So when we're talking about children, that can be a very frightening experience for them. And one of the things that we see with kids when they have panic attacks, then a lot of times they will start becoming worried about having another panic attack. And so it ends up kind of building upon itself. Specific phobias is when you are fearful about a specific thing. So such as snakes, spiders, storms. It is usually triggered by a bad experience. However, it can also be an internalized fear. So the hallmark of this is that the fear is excessive and it interferes with your enjoyment of life. So it's fairly normal for individuals to, for instance, have a fear of insects. However, if the child is so anxious about insects that they're not able to go outside and enjoy going outside with friends because of that fear, that's when we start looking at it as a specific phobia. Separation anxiety disorder is when you are fearful of being separated from a caregiver. So, as I mentioned earlier, this really can't be diagnosed until at least the age of 3, because before that, separation anxiety really is natural and normal. What I found with kids with separation anxiety disorder is that they are often either fearful that something bad is going to happen to their caregivers when they are separated, or they're afraid that something is bad is going to happen to themselves when they're separated from the caregiver. Sometimes it can be a mix of those as well. And then social anxiety disorder is where you're fearful in social situations. And specifically, the fear is that you are going to do something embarrassing, or that others are going to see you and think that what you're doing is stupid or embarrassing. And so there's this fear that others are going to criticize them and judge them for making a mistake or doing something embarrassing in public. And then selective mutism is where an individual chooses not to speak in certain situations. Now, the person may not be cognitively aware that they are still able to speak. So it is more of the brain making that choice because of a feeling of overwhelm. The most common probably experience of that is having stage fright. So, someone gets up to speak in front of a class or in front of other people in an audience, and all of a sudden they're not able to talk. Physically, they are still able to speak, and the anxiety is so intense that that kind of shuts down and they are not able to verbalize anything. So, generalized anxiety disorder is excessive worry for the age. So, we're talking about, again, looking at those developmental stages. What is normal anxiety for a child this age? And is the anxiety excessive? So, one of the things that we look at is, are they having anxiety more days than not? Are they having an inability to stop the worry? So oftentimes kids will talk about that they try to stop the worry, they try to think about something else, and they get stuck and they're not able to stop the anxiety that is just continuing over and over again, and they are not able to stop what's going on in their mind. We also see irritability and agitation. And with children, we probably actually see that more than adults. So if you think about, times that you have been anxious as an adult, you typically will feel agitated. You might even feel irritable. And as an adult, you can usually have some understanding of the reason that you're anxious. You also probably have more coping skills to manage that anxiety. So when we're talking about children and being anxious and not having that cognitive awareness, not having a fully developed frontal cortex, not having that impulse control, this is where we see kids becoming very angry, very annoyed, very easily when they are in their anxious brain. Kids with anxiety also often complain of headaches and stomach aches. So that kind of goes back to that brain-gut connection, is that when an individual goes into fight, flight, or freeze, biologically, the digestive system shuts down because the energy from the digestive system ends up being transferred to other parts of the body that are needed for that fight or flight. So because of that, there are the stomach aches, the stomach upset. We talk about having butterflies in our stomach, feeling nauseous. And then the headaches, are again oftentimes stress related. And then you also have difficulty concentrating and difficulty sitting still. So when you think about that, when you are really anxious about something and you have that agitation in your body, you get kind of like wiggly, squirmy. It's hard for you to sit still. A lot of people will get up and pace when they're anxious. You also have difficulty concentrating because you have all of these anxious thoughts in your mind. What can sometimes happen with children is that difficulty concentrating and that difficulty sitting still can be misinterpreted and misdiagnosed as attention deficit hyperactivity disorder. So I have had a handful of kids over the years who have been referred to me because someone in the school setting or a caregiver has thought that the child had attention deficit hyperactivity disorder when really they had an anxiety disorder. With the kids with anxiety, they also tend to be very self-critical and they tend to have low self-esteem. And a lot of that has to do with the frustration and struggles to control their anxiety and feeling negative about themselves that they are not able to control it. The other thing that usually is happening is that the anxious brain is causing them to be critical of themselves. They also often have difficulty sleeping and are often tired. So again, if you think about as an adult, when you have been really anxious, you have a hard time oftentimes falling asleep. So this happens for children as well. And then if you think about children who have not slept well and are sleep deprived, they are often irritable and agitated during the day. And so that ends up adding to that irritability and agitation. So oftentimes when I'm dealing with families where a child or teen has anxiety, one of the things that I target first is that lack of sleep. Because if they aren't sleeping well, that's going to make everything seem much bigger and more extreme. So, as I said earlier, the separation anxiety disorder is fearful of being separated from a caregiver. Um, so, when we're looking at diagnosing that, the things that we're asking kids about is what are the fears about being separated? For how long can you be separated from your caregiver before you become anxious? What are the situations? Because there are times where kids can be okay with being separated from a parent if they are with another trusted adult. Or they're okay with separating from school because they know that they have other individuals around them. So, we have to kind of look at what are the situations and the triggers for this, and that is what the therapist will kind of dig in deeper with them. The social anxiety disorder, that fearful of social situations, again, when we're diagnosing and we're looking at that, is we're looking at, what situations is that social anxiety coming up? Are we seeing it more in social groups, in activities? We're also looking at the severity of it. Is it keeping them from attending activities? Are they having excessive worry days before the event? Are social situations leading to panic attacks? With the selective mutism, which we mentioned earlier, is choosing not to speak in certain situations. We're like looking at what are the specific situations that trigger that. And again, is it something that is more developmentally appropriate? Because most kids, the first time that they get up and speak in front of someone or have an audience are going to be nervous and may have a little bit of stage fright. And again, we want to look at how severe is it? How much is it impacting their functioning? Is it, in everyday social situations? When do they feel safe? When do they feel threatened with the anxiety, with the selective mutism? There are also individuals with selective mutism that they only become mute around certain people. So there is a phenomenon, for instance, that individuals will go mute or have the selective mutism when talking with someone of the opposite sex. So those are the things that we're kind of digging into with the diagnosing. So what does anxiety look like in children? Well, children with anxiety tend to be highly emotional and they have difficulty regulating their emotions. So if you go back to what we were talking about with the research, there is that disconnect with the prefrontal cortex. And because they are getting so anxious and so highly emotional, they're having that difficulty regulating their emotions. So some of the physical symptoms you may see are things like shaking, because shaking is our body's natural way of releasing stress and anxiety. You may see fast or shallow breathing. That is showing that you're moving into that fight, flight, or freeze. So you're trying to get that breath really quickly, that oxygen into the lungs quickly. They may have upset stomach. They may have a flushed red face. Sweaty palms can be another thing that occurs. Dry mouth. The dry mouth has to do with that fight, flight, or freeze response and the shutting down of the digestive system, because having saliva is part of your digestive system. So that's where anxiety can impact that dry mouth. And then, of course, having a fast heartbeat. So again, trying to get oxygen to the body and the limbs quickly to prepare for running or fighting. So let me go back up to the question and answer just real quick and see if there's a couple of other things that I can answer. Someone had asked about, kids who have habits like biting their fingernails, and does that mean that they're worried or anxious? It's one of those things where it really depends. So some kids will bite and chew on their nails more as kind of a sensory experience. So it may be that they feel like something is wrong with the finger or wrong with the nail, and so they're biting at it in order to get rid of that sensation. It can be just a habit that they form that, biting or sucking on their fingers is calming, um, because they did it as a very young child and it's just continued. There are kids that bite on their fingers because it's something that's readily available to give them kind of sensory input. And then there are kids who bite on their fingernails because they are worried and anxious, and it is a nervous habit. So it kind of gives them something to do. So someone had mentioned that, a lot of the symptoms can sound like ADHD, and so how do you distinguish that to ensure the diagnosis between the two? Um, that can be tricky. Part of it is that you need someone who specializes in children's mental health and knows how to ask the questions to be able to elicit from the child responses to understand what is underlying this and be able to understand that the anxiety is a piece of this. The other difficulty is that there are individuals who do have anxiety and ADHD. So if a child is really showing significant symptoms of ADHD and anxiety, my recommendation usually is to work on the anxiety first and then see if the ADHD symptoms get better. Because what I've often found is that those ADHD symptoms a lot of times are a byproduct of the anxiety. If we work on the anxiety and have a pretty good control of the anxiety symptoms and the child is still showing ADHD symptoms, then we may look at doing specific treatment for the ADHD. There are some people that go the opposite direction and will try to treat the ADHD first, because we do know that stimulant medication works 80% of the time with ADHD. So oftentimes they'll try a stimulant medication to see if the symptoms subside so that they can figure out if it's ADHD or anxiety. The issue with that is that stimulant medications can trigger kids and teens with anxiety and make the anxiety worse until the stimulant is out of their system. So let me get back into the presentation. One of the books that I really love about talking to kids with anxiety is called Hey Warrior from Karen Young. So in the book Hey Warrior, it talks about how our amygdala is there to protect us. However, sometimes it protects us when we don't really need protecting. So it's kind of like a fire alarm. Fire alarms are supposed to go off when there's a fire. However, fire alarms also can go off because someone has burned something in the kitchen. I had my fire alarms go off in my home because we were remodeling and there was a lot of dust, and the fire alarms interpreted the dust as smoke. And so the thing is fire alarms don't really care if it's actually smoke from a fire. Their job is just to alert us to know that something is wrong in the environment that could potentially be a fire. So that is where the amygdala can sometimes misinterpret certain things, where it assumes that it is a danger when it's not really a danger. So oftentimes one of the things I'll talk to kids about is there is a difference between things that are scary and safe and things that are scary and dangerous. And that we have to be able to differentiate between the two of those, because scary and safe is usually anxiety. Scary and dangerous is self-protection and self-preservation. The other thing that the book talks about is how strong thoughts and strong breaths are the way that we learn to manage anxiety. So we have physical things we can do, and then we also have cognitive, mental things that we can do to help our amygdala calm down and be able to get back into our thinking brain instead of being stuck in our emotional brain. So what are the options for treatment? So what we have found is that multimodal treatment is found to be the most effective. So a randomized controlled trial of 488 children with social anxiety disorder, generalized anxiety disorder, and separation anxiety disorder found that a combination of cognitive behavioral therapy and sertraline, which is an antidepressant, was more effective than just cognitive behavioral therapy or just the antidepressant. So when there was a combination of therapy and medication, there was an 81% improvement. When it was just cognitive behavioral therapy, there was a 60% improvement. And if it was just medication, there was a 55% improvement. So we're basically talking about 30 to 35 percentage points higher when you combine cognitive behavioral therapy and medication. So what exactly is cognitive behavioral therapy? Well, cognitive behavioral therapy is about being aware of your self-talk. It's providing an opportunity to examine the accuracy of your thoughts and then replace them with more adaptive thoughts. And then there's also a behavioral component of understanding certain skills that you can use, such as relaxation strategies. There is a piece of cognitive behavioral therapy that is referred to as exposure therapy. So exposure techniques are used to address avoidance behaviors, which is known to maintain or worsen anxiety over time. So you are exposed to the thing that you are anxious with in small steps until you become more desensitized, and therefore that situation or object is no longer triggering the anxiety in such a severe way. And then the medication, there are certain selective serotonin reuptake inhibitors, which are referred to as SSRIs. They are antidepressants. However, antidepressants also target anxiety. So when someone talks about being on an antidepressant for anxiety, SSRIs actually treat both. There are some specific anti-anxiety medications, but when we talk about anti-anxiety medications, we're usually talking about things that are more like tranquilizers to get you through a specific situation without having excessive anxiety. The other treatment is really about stress reduction. So as I mentioned earlier, sleep is one of the biggest things. So making sure that the child or teen is getting 8 to 10 hours of sleep. And like I said earlier, sleep has a huge impact on our mental and our physical and our emotional ability to manage stress and anxiety. So work on soothing bedtime rituals. That can be having a bath, listening to music, reading, stretching. The smell of lavender is known to be a calming and relaxing scent. Make sure that kids are getting at least 60 minutes of exercise a day. Exercise works off that excessive energy that is being pent up in the body with the anxiety. It can decrease stress levels, and it can also increase positive hormones and brain activity that helps us feel more positive. So exercise can be kind of a natural antidepressant in a lot of ways. Make sure that they are eating a healthy diet. So eating foods that keep the blood sugar steady. So you want to avoid refined sugars and simple carbohydrates. The reason for this being, again, is when you're highly anxious, the digestive system is not working as effectively and is going to have a harder time breaking those things down. Also, during fight, flight, or freeze, your blood sugars get increased because your body is sending out glucose to get you ready for that fight or flight. It's giving you that energy. So refined sugars, carbohydrates are just going to add to that. Caffeine can bring on anxiety, especially panic attacks. So decreasing caffeine use, and I think that is especially important for teens because they tend to take in a lot more caffeine. And then doing soothing things. So walking, bathing, playing with pets, using your five senses, all of those things are going to help relax and release. So what are some things that we can do for our kids to help them through this? So the first thing is just recognizing that it is not possible or productive to try to remove all anxiety experiences. We have to allow our children to feel what they're feeling. We have to allow them to be exposed to things that they are anxious to. So instead, what we want to do is support them in learning effective ways to cope. And when I'm talking about those effective ways to cope, teaching them the strategies to calm themselves, you want to practice those strategies when they are calm so that it becomes a body memory and they are more likely then to be able to access that when they are starting to get anxious. We want to avoid dwelling on solving how you are feeling instead of are you worried. So we want to look at how we are phrasing situations. So instead of asking whether they are anxious about a situation, asking an open-end question about the situation and what is triggering you right now. The other thing is just to be with them, to help them co-regulate. For especially young children, having your physical presence there and you being calm and having your emotion and your system regulated is going to help the child regulate theirs. So we don't want to escalate the anxiety with them. We want to be a calming presence. We also want to teach them problem solving skills because we want them to get back into that rational, that thinking brain. So asking questions like, what do you need right now? What would help? I notice that you're starting to get anxious. What would be useful to you? And the more the kids learn to identify what they need and ask for what they need, the less anxious they're going to be. We also can help children start to notice their physical signs of anxiety. So, are they clenching their fists? Are their shoulders getting tight? Is their breathing starting to get heavy? So helping them get into their body and notice what their body is telling them. We also want to work on having routines that are grounding. Structure and routines are calming, they are grounding, they help kids know what to expect. Practice deep breathing with them. And again, you want to do this practicing before the anxiety happens. So again, it becomes more of a body memory, so they immediately go to it. For young children, you can also try a distraction. So if they start getting anxious, I spy with my little eye something that's blue. And by asking that question, again, you're getting them back into your body, you're getting them back into their cognitive brain. You can also do the 5, 4, 3, 2, 1 method, which is tell me 5 things that you see, 4 things that you hear, 3 things that you can touch, 2 things you could smell, and 1 thing you could taste. And the 5, 4, 3, 2, 1 works for young children all the way up through adults. It's a very simple grounding activity. Make a worry box so the child can write down their worries and add them to the box. So it allows them a way to express the anxiety and let go of it for the day. And then at the end of the day, you can come back to that worry box and talk about and process what they have been worried about. Ahead of a big change, give your child time to adjust to the idea, talk about the reasons behind it happening so that they're prepared and they know what is going to occur. To calm down a child during a panic attack, give them an object and ask them to describe it in as much detail as possible. So again, coming back to some type of grounding type activity, something that they can touch, feel, smell. And then model good coping mechanisms at home so that you can also teach them how to deal with it on their own. So if you have good coping mechanisms and the child is seeing that, then that can be a model for them. So tomorrow when you get the recording, you'll get the recommended readings. You'll also get crisis resources. These are resources in the United States. You'll get a list of our upcoming webinars. You'll have all of our contact information. And then just a reminder with the frequently asked questions, you will get a recording of the webinar and we cannot send out the individual slides. We cannot provide professional continuing education units for the community education webinars, but you might be able to get credit with that certificate. Everyone who registered for today's webinar and joined the live session will receive an email from certificates@mindspringhealth.org soon after the webinar ends. If you complete that webinar follow-up survey, you will automatically get your certificate. Your feedback is anonymous and confidential. And even if you do not want that certificate, we really encourage you to fill that out because again, that information helps us. It also goes back to our funders so that we are able to continue to provide these webinars free of charge to the larger community. So that is the end of the webinar today. I just want to thank everyone for logging in today. And I appreciate all of you who were so patient while we were working out some of our technical issues at the beginning. And wherever you're at in the world today, I hope that you have a good rest of the day, and we hope to see you again soon.